I think preparing yourself emotionally and physically for a stacked DIEP and PAP, having a good support system at home and having help and leaning on people and being real that you're gonna need some help at home, offloading yourself from work responsibilities, not putting too much pressure with no buffer, to allow your body to recover from the stress of surgery is important. I don't know what you'd like to add, Sean.
I think it's rather interesting that throughout the history of medicine, modern medicine, we've ignored the effect that the mind has over the body so often. The reality is that your mind and how you feel coming into surgery has huge implications on your recovery. Stress is a significant cause of healing difficulties and problems. It affects critical hormones, including cortisol release in your body. And I feel that one of the things that is often not talked about enough is preparing yourself to be mentally in the right frame of mind prior to surgery. I think there are thousands of techniques that we can do to improve our mental state before surgery. Things like meditation, prayer, faith, reliance on friends and family, all of those things, preparing ourselves to be coming into surgery with the least stress as possible, with as much support as possible, gives us the emotional energy and strength to help get through surgery in the fastest, easiest, and best way.
I totally agree, and I would also add, while you're speaking, I'm thinking it's a two-way street between patient and surgeon. So it's important for the patient to really know what to expect on the other end of surgery and not be surprised. If the patient is surprised, it's going to put a lot of stress. And so if you're the patient undergoing the surgery, you want all your questions answered. There should be no heavy burden or uncertainty on your shoulders as to what you're embarking on. And I think it's important for the surgeon to know that we want to know that you're going into surgery clear, that there's no uncertainty, that you're comfortable with the plan, that you know the risks and the alternatives, and why we're actually doing this, and that both of us go through surgery with the end in sight and a very clear path. I think is really important. I think also to younger surgeons, certainly when I was starting out in practice, you just want to do everything to please the patient, but you also want to make sure that you're very clear to the patient of things that you can and cannot deliver, things that are realistic, things that may not be realistic.